thank you for a wonderful lecture. It was very inspiring. And could you tell us a little bit about yourself?
Of course. Well, thank you for having me. I'm Newton Fahl. I'm very pleased to be here. I live and work in Curitiba, Brazil, where I have my practice, and I have the teaching center, the Fahl Center. I have been in practice for 25 years, and I enjoy doing cosmetic dentistry very much. That's my passion in working and in teaching.
Well, Dr. Newton, do you think there's hesitance among general practitioners to take composites to this level?
Yeah, I think the major fear or hesitance about composite lies in the fact that composite are polymers, they're plastic materials. And the misconception is pretty much based on the fact that they might break or fracture or not be as aesthetic or even long-lasting as a ceramic work would. And that is unfounded information, because composites can be used to the utmost perfection and effectiveness, provided the clinician understands the basic concepts. So I think composites are misunderstood, and if one really understands what they are and how they can be implemented effectively, they will be just as last-longing, if not more, as porcelain work.
Yes, you have really showed us how this is possible today. And what's the starting point? Where do you begin?
The starting point is practice makes perfect, but only perfect practice makes perfect. Okay? So it all starts with one learning the fundamentals. Composites are just like implants, or pros, or ortho, or endo, or perio, for what you care. It requires on the part of the clinician to go through some intensive training and understanding the fundamentals of composite artistry. And that entails the knowledge of anatomy, the knowledge of composite materials, composite science, and really understanding color science to bring it all together in a shape that will lead the general practitioner into getting better and better and better and reaching a higher level time in, time out. So it all starts with fundamentals. I think fundamentals are the key.
Yes, today you've really shown us a lot of different possibilities. Could you expand on that, please?
Absolutely. I truly believe that composites present us with a myriad possibilities, from the simplest to the most complex scenarios. It may vary from minor incisal edge augmentations, such as minor enamel chips, going from there to diastema closures, expanding onto class 4s that are a little more invasive, or even peg laterals or crown buildups, depending on the situation. So composites are really very versatile from that standpoint, and all that will determine whether you're going to go the simplest or the most complex route is the knowledge and the ability of the practitioner to implement them effectively.
And is there a role for the lab technician in this process?
Absolutely. I think lab technicians are a major part of any restorative dentist's life, in that he or she can help the dentist to pre-visualize and pre-plan a more complex case, which involves from mounting, waxing up, getting proper form, should the restorative dentist not be able or not have the time to implement that him or herself. So the lab technician will come into play in helping in the treatment planning process. Composites are done primarily directly in the mouth, so the general practitioner will be the one to carry on with the technique. But the lab technician will help to supplement enough information to help the dentist achieve the utmost aesthetics, and that has to do with form and function.
for the composite beginner, taking it to the higher level, what are the best cases to start off with?
I think the one case that I like the most is diastema closure, because it deals primarily with shape, and a diastema closure may require only one shade as opposed to many shades. So if the apprentice or beginner will master form with one shade, that's key, that's very good. Then I would move on to, say, small class 4s or even class 3s and class 5s that are not really challenging, and work with as few shades as possible to work more of the form per se rather than the polychromicity of the restoration. So I would start very slowly without working the more severe direct veneering cases that will entail a change of value, like taking a dark tooth and making it look light and of the right value. Those are the challenging cases. I would not expect a beginner to master these types of challenges right from the start.
Thank you so much for lecturing for us. It's been a great pleasure.
Thank you. It's been my pleasure and my honor to be here.
Thank you.
Thank you so much.